My name is Siri Wilson. I am a foodborne disease epidemiologist with the Georgia Department of Public Health. I graduated from undergrad at Florida State University in 2006, and I got my master in public health from Mercer University in 2009. So typically, what I do is I work for the state health department as a foodborne disease epidemiologist. So a day-to-day for me is I have currently three disease areas where I am the subject matter expert: Shiga toxin producing E. coli, hemolytic uremic syndrome, and Campylobacter. I also do surveillance for the hospitals in Northwest Georgia. And I also serve as the NARMS epidemiologist, which is the National Antimicrobial Resistance Monitoring System epidemiologist, in which I do surveillance on Salmonella, Shigella, and Campylobacter, and look at specific data elements and exposure questions for antimicrobial resistance. So these enhanced data elements captures information when we do a public health interview on cases where we look at what international travel they had, duration of illness were they seen in the ICU. We also capture information about if they had any probiotics or what antibiotics they may have taken for the illness. So my day-to-day is usually checking to see if we have any new cases, letting our district or local epidemiologists know that they have a case that they need to be interviewed, or if they can't interview it, then I give it to the student intern team for them to follow up. And that's about it. For hemolytic uremic syndrome, we usually only see a small amount of cases per year. So for that is really hands off. The local epidemiologists don't have to do much for those. I do intense chart abstractions using either the medical record received from the hospital or the electronic medical record if I have access to that particular hospital system. And so I will say that my day-to-day changes per day. I do keep a daily task sheet to assign myself different duties per day so I can stay on track. My advice is to look for any internships that you can find. When I first started, when I was in my master's program, my program was new, so our resources were limited. So we didn't have we did have to do a practicum, but our options were limited. So my practicum experience was actually in injury prevention. And I honestly did not know where I wanted to go in public health. I knew it was something that I wanted to do. So my practicum was on injury prevention. My thesis was actually on homicides. And then I ended up being a county epidemiologist at first. And I actually fell in love with that. So I would say just research as many internships as possible, try to get involved as much as possible and network, because I ended up, once I transitioned from the county in Florida and moved to the Georgia Department of Public Health, my old professor actually put in a good word for me because they realized that when I went to Mercer, they knew that he was a professor there and he was actually a local epidemiologist in Georgia. So they were able to ask him about me and my personality. So talking to your professors and networking outside of the field is also great.